We are now at the portion of the agenda, even though we're woefully behind schedule, we're not going to get back on track. So what we're going to do, we had hoped to do some pulse check questions with you electronically. What we're going to do is send that to participants as a post survey, and then we'll get the information back out to you. But at this time, I would like to introduce our panel facilitator. Her name is Sandra Bird Chappelle. She is the founder and principal of Strategic Solution Partners, a consulting firm which partners with public, private, and governmental agencies to develop solutions to complex issues. She has an extensive background in health, human services, community engagement, government, and philanthropy. If you look in your program booklet, you can see she has a whole full page of expertise and skill. But I'll tell you, I first met Sandy as a county employee, and she was a sponsor of many people who was working in government. And I've been a recipient of her expertise and consultation and support for, I won't say how long. You can say. For a long time. And so when we were looking for individuals to serve on this planning committee and become a part of the coalition, she was the first person that was in my Rolodex to call. She has the capacity and the knowledge around budgeting, planning, fiscal responsibility, and a value for people and services and quality that makes her the person that we would want to facilitate this panel. So I would like to introduce to you Ms. Sandra Bird Chappelle.
Thank you very much, Francis. And before we get into the panel discussion, I have to do one housekeeping issue, and that is we're a bit behind schedule, and so one of our panelists, Greg Brown, if we are not finished in time, and I doubt that we will be, you're going to see him exit the stage at about 12:15. Don't be alarmed. We're just off schedule, and he has another commitment. Before we get into the panel, I wanted to set the context a little bit for the discussion that we're going to have, and we were beautifully set up by our two keynote speakers, Chip Allen and Rukiah Yerby. And we can put the slide up on the screen. You guys also have a framework for health equity in your packets, but I believe it's also going to be displayed on the screen. No? No? Okay. Well, so look in your packet. I saw it on the screen earlier, so I know it's in there. But at any rate, look in your packet. I think it's the last page in the right. There you are. But you also have it in your packet. So this is the health equity framework that we're going to be using as we delve into this panel of experts to help us understand how we might get to that place that Chip asked us, what does health equity look like? But before we do that, I want to make a quick introduction of the members of the Center for Achieving Equity, some of whom were on the panel. Greg Brown, raise your hand. You have your, who else is in the audience? Sabrina Roberts. Maybe you guys can stand that are in the audience. And Kim Foreman, Marka Fields, Freddie Collier is on the panel. Is anybody else in the room from the Center for Achieving Equity, which was formerly Cuyahoga Place Matters? But anyway, these folks have been volunteering, many of them for over a decade, to help promote health equity throughout the region. I wanted to thank them. They are a phenomenal, mighty, cross-sector group of professionals who have donated their time towards making Cuyahoga and the region a better place to live. We wanted to acknowledge them. And this framework for health equity comes from a national learning and community of practice group called the Collaboratives for Health Equity. We have borrowed this framework, adapted it to the use of the greater Cleveland and beyond community, and we'll use this framework as the context for how we discuss promoting health equity with this panel of experts. A couple of things that I heard when Chip and Rukiah were speaking that I wanted to lift up and keep in the forefront of your mind. We heard some things that I think related to an interconnecting theme about how values affect opportunity in America. And those unconscious storylines that have been adopted, which also includes how we internalize values that relate to ourselves. We heard things about land use and home ownership and the fact that redlining persists and what we need to address in terms of city-county development plans and mixed income communities, as well as structural racism. One of the things that we didn't hear that I wanted to leave as a definition for you to let sit with you is what really is the definition of racism. Because sometimes I think we confuse that with other things. And the definition that we often use at the Center for Achieving Equity is race prejudice plus power. So let that sit with you for a little bit as we continue this conversation. I want to introduce the first panelist, Christian Farmer, who is the founder and the executive director for Birthing Beautiful Communities. I'm looking forward to hearing from her. Greg Brown, who is the executive director of Policy Bridge, also manages his own consulting firm and is a member of the Center for Achieving Equity. We have Margarita, who I affectionately call Margie Diaz, who is the manager of health equity initiatives in the Office of Inclusion and Diversity at the Metro Health System. We have Reverend Dr. David A. Cobb Jr., who is the pastor of Emmanuel Baptist Church in Cleveland, Ohio. We have Lena Grafton, who is one of the hosts of our symposium today, but also serves as adjunct faculty at the Cleveland State University School of Health Sciences, faculty in the Department of Family and Community Medicine, College of Medicine at Northeast Ohio Medical University, and a community engagement coordinator for the NeoMed CSU Partnership for Urban Health. We have Reverend Dr. Jawanza Colvin, who is the pastor of Olivet Institutional Baptist Church in Cleveland, Ohio. And last but not least, we have Freddie Collier, who is the director of the City of Cleveland's Planning Commission. So I want you to give a warm welcome to all these panelists. And then we're going to start. So if you look at this framework, you'll notice that it puts forward the notion that health, it's not on the screen anymore, okay, that health is shaped by the places where people are born, live, work, worship, and play, and acknowledges that those places are heavily shaped by values. And those values find themselves embedded in local, state, and national policies. And what we are acknowledging with this framework is that there are underlying, closely held beliefs, some conscious and others unconscious, that shape our values. What we want to get the panelists to do for us today is to dive into a few of the sectors that can help us both work at eliminating the root causes of health inequities, but also give us a frame for how they're putting equitable policies and practices into play in Greater Cleveland. When you look at this framework, you'll notice that it is divided into two halves. One half on your left talks about values, institutional power, social conditions, and family and culture. Those are the socioeconomic things that shape health. And by health, we are talking about a broader definition of health that doesn't just include physical health, but it also talks about whether or not you have been fully included in economic opportunities. On the right half, which is we can call it's in red, and it's those downstream factors that we need to address, but they don't actually get to root cause. So we need this whole continuum, but our discussion today is to help us think through and help you provide input into how we get at the root causes of health equity or health inequity, or how we build health equity into the fabric of our community. And you'll see at the bottom there that community-led visioning and planning needs to run across the entire continuum. So soak that in just a little bit. And notice that those downstream factors talk about individual health knowledge, genetics, risk factors and behaviors, disease and injury, and mortality. And we need to do things to intervene there. But if we focus on that left side in green, those upstream factors are the things that are going to help us prevent some of the conditions and some of the practices from ever coming into being. So keep this in mind as we continue to have today's discussion. We want to start off by asking Greg a couple of things, and Greg has been involved in discussions around community and economic development for quite a while. And we've talked about the values that help shape the policies and the conditions that we live in. And I want to ask Greg to give the group a better understanding of the notion of perspective transformation.
All right, can everybody hear me? Good, good. Good late morning to everybody, and thank you, Sandy, for the question. Perspective transformation is really a term that we've been using in our racial and health equity work to try to talk about just what Chip began his presentation with this morning. And it is, how do you get to a point where we start to think differently about what's going on in our environment? In many cases, we spend a lot of time looking at the conditions in our environment and thinking that most of them happen by happenstance and most of them are beyond our control. I want to give you a quote that I use at almost every presentation now to try to help people to think a moment differently as a way of understanding how perspective transformation works. And the quote is from Dr. Harry S. Green, who is a systems change theorist, and he works at the University of Chicago. And his theory says that every system is exquisitely designed to produce the result it gets. Think about that for a minute. Therefore, it isn't by happenstance. It's by design. It's planful. It's intentional. And the only way to uncouple from those kinds of things is, first of all, to have the introduction of information and data that challenges the assumptions that you're working on. We saw some of that this morning from both Chip and Rakaya. The second thing you have to do is then spend some time thinking about what the data says and also trying to understand it differently. And by understanding it differently, not only just challenging the assumptions, but asking a different set of questions that would bring you to a different orientation about how to think about the problem. And third, but certainly not the least, of perspective transformation really is, once you've had those thoughts, now you have questions that you need to address. How do you develop plans, tactics, strategies, and implement those in a way using an equity lens so that as you proceed, the question of equity is not at the bottom of the list, not at the middle of the list, but at the top of the list and covers everything you do and is questioned in every evaluative criteria that you create. The only way you're ever going to start to act differently is to think differently. And to say it quite frankly, we're a pretty lazy society. We go along to get along. We go with the status quo because it might make us a little bit uncomfortable. Well, I'm here to say, if we're not uncomfortable with the state of the country and the world the way it is, then look out, man, it's coming. And when it hits you, don't be surprised. So the inequities we have are by design. They're purposeful. We were set up on a racial construct. This country was. In its constitution, it said that people who were slaves were not even human beings. They were property. And they were 3/5 the equivalent of a human being. So how could we not have a country that is inequitable on its face that emanates from that as the law of our country? We've got to start to think differently. We've got to start to understand that thinking differently. We've got to ask critical questions using an equity lens, and then we must prioritize our actions based on that equity lens so that everybody has a fair and equal opportunity.
So when I looked at your resume, Dr. Colvin, I noticed the definition of Christian praxis. I'd love that when I read that in your bio. And I wondered if you would talk a little bit about what that actually means and how that reflective practice connects to this whole notion of perspective transformation and how we create and identify values in our society.
You did do your homework. You're right. No, Christian praxis is simply the idea that your faith as a believer, as a disciple of Jesus Christ, first century oppressed Palestinian Jew, is reflected in, not in one's witnessing to an evangelical idea, but how you live your life as an ethic. And so your witness is demonstrated in your ethic, not in your evangelism. I think that for me, I think that it is a part of what the great tradition of the Black church has always been. I think the great church, tradition of the Black church has always been trying to exact not so much the spread of the gospel of Jesus Christ, but also to really try to exact that in the living in these days for people of color, those whose skin has been kissed by nature's sun. I think in many respects, what Brother Greg Brown has said is accurate, and that is that, you know, next year will represent 400 years since 1619, where the first Africans came to this continent in Jamestown. 400 years of trying to be treated as human. We hold these truths to be self-evident that all men are created equal, endowed by their created with certain inalienable rights, among them life, liberty, and the pursuit of happiness. But we know when that document was written, it did not include many of the people in this room, probably the majority of people in this room. And so we have to recognize that the work that we do is not a work that is about equality. It is a fight for humanity. Equality is a policy. Humanity is an acceptance of my existential state in life. And it's really critical because when you do this work, you have to recognize that whether you're talking about data points, whether you're talking about policy, whether you're talking about initiatives, whether you're talking about funding, you are fighting for people to be treated as human. Right. For me, that is fundamentally, as a person who grew up on the wrong side of many of these social indices, I feel like I am fighting for a people to be treated as equal. I mean, as human, to be recognized. And everything after that falls in line. Because when we're talking about humanity in that sense, we recognize it comes in different shapes and forms and expressions, but at the same time, we should all have adequate access to the same resources and opportunity to fulfill our greatest possibilities. And for the last 400 years, and for the last 50 years, when we've seen coming out of the most recent report that African Americans are actually doing worse in so many areas since the Voting Rights Act, the Civil Rights Act, the 1972 Fair Housing Act. And so we've got to, as someone has pointed out, I've been talking about, and I overheard a conversation, we've got to examine our practices for their effectiveness. The Black church, and I'll close with this, you know, the Black church has fundamentally been engaged in this work of trying to get people treated as human by trying to make sure that it housed our humanity during a period in which in this society we were not treated as human. So it's been the place where our music, our culture, the incubator of our businesses, the incubator of our educational institutions. And so this idea that the church can be on the margins in this continuous struggle for our humanity is simply problematic. And we have to recognize that on this continuum of humanity, there are some that are being treated more humane than others. And I'll give you this quick snippet from scripture without having to take a text. And that is, in the theme of liberation of Moses bringing the children of Israel out of Egypt, there were 10 plagues. And each of those plagues, Pharaoh would not let the people go. He would not let the people go. Moses brought another plague. Moses brought another plague. They would not let the people go. It wasn't until the last plague. And what was the last plague? The last plague was when every household that did not have blood on it, the male child in that household would die. It wasn't until Pharaoh's son died that he did something about it. Sometimes the problem is the wrong people have not been affected.
That's right.
The wrong children are not dying.
That's right.
The wrong neighborhood is not having their infant mortality rate second to that or rivaling North Korea. Sometimes we have to make sure that we are, in our fight to be treated as human, we have to make sure that people understand that we either can live together as brothers or we can die separately as fools, as Dr. King said.
So one of the things that I hope that we're noticing, that regardless of the discipline that you're in, there's this whole notion of what I would call reflective practice. And for those of you who are in public health, that's a public health term. And so we know that we ought to be thinking about the outcomes that we are getting and trying to figure out why those outcomes aren't consistent with our stated goals. So as you're listening to individuals speak on this panel, regardless of whether or not they represent a sector with which you identify, understand that the practices, the concepts that they're bringing forward are consistent, whether they have a different name or not, in whatever discipline you find yourself, okay? So having said that, we talked a bit about how values shape policies and policies shape opportunity. And Greg, you've been involved in community and economic development for a long time. Can you talk to us a bit about that worldview and help us understand how those social constructs come into play today?
I notice you keep using the word long time when you talk to me, Sandy. Is there something personal going on there?
I've known you. Well, if I've known you for a long time, what does that mean about me?
Well, I have nothing to say about that. I've been married 32 years. I've learned my lesson. I think, once again, if we understand connections and how things operate and how they're structured, it becomes a little less complex for us in terms of our understanding, and then we're able to kind of root out some things. When you talk about policies, and one of the things that I was so glad that Rakaya talked about this morning was these neutral or supposedly neutral-based policies that are instituted all the time. One of the things we know about policies are always connected to somebody's values. And those values are really about what they believe in, how they've been acculturated, and those things that they see as a system of operating for their benefit. So when we talk about the development of policies that are neutral in their basis, they cannot be, because number one, no human being is neutral. And number two, we always include our values as a way of developing our policies, whether they're institutional, whether they're governmental, whether they're in our private lives, or any other place that we operate. The problem is that many of the values that we have as general values in America are all from a point of view that is Eurocentric, male-dominant, WASP-oriented. So that, in fact, when we start to think about it, it's not all of our values being taken into consideration. It is a subset of everybody's. Yet that subset has been the dominant culture, the dominant way of thinking, and the dominant worldview that we've operated on for centuries. But look at where we are today. We look at broad disparities everywhere. And they're not just in the African American community or Latino communities. As Chip was saying, everywhere you look, most indicators are pointing downward. We're not doing as well as we were supposed to be doing. And for the first time in generations, the generation now is not expected to do as well as its parents. So that means we're in decline. Well, we're not in decline because everything that we've upheld for the last 200 and some odd years is still beneficial. The context has changed, the environment has changed, and we still do not think inclusively about everybody fully participating and optimizing that participation for the benefit of all in our society. So the one thing we have to stop doing is thinking that these are our values. They are not. And if we want our values to be considered, we must develop strategies, tactics, opportunities for discussion, and demand that our values are considered when all other values are being considered. Once again, it goes back to the questions you ask will lead to the conclusions you want. But if you don't ask the right questions, you'll never get the right answers. You only get what you've been getting. And as a world-renowned physicist once said, doing the same thing over and over again and expecting a different outcome is what? Foolish. Insanity.
So let's take those thoughts and begin to think about how we disrupt those patterns, the same way of thinking producing the same results. And we're going to start with Kristen and ask you to talk a bit about the work that you're doing with Birthing Beautiful Communities, how you came to the conclusion that that work needed to be done, how you were initially resourced to do that work, and the outcomes that you're seeing in the community.
Sure, thank you, and I apologize in advance. I'm fighting a case of laryngitis. So yes, I founded Birthing Beautiful Communities about 4 years ago, sort of this concept. I was always very interested in birth work, and I was just, happened to be obsessed with pregnant women and newborn babies. And so I became a doula. And when I became a doula, I quickly realized that there were not a lot of African-American doulas in the city of Cleveland or even within Cuyahoga County. And in fact, I had to go to Strongsville, I believe, to get my initial training, and that really bothered me considering Cleveland and Cuyahoga County had a very high infant mortality rate for African-American babies in particular. And I used to work with a nun who was a doula, and she did some work with high school students at Collinwood High School, which is my alma mater. And she came to me, she had 2 African-American teens, and she asked me if I could become their doula. They were both expecting. And she was very honest with me. She was a white lady, a nun, and she said, I can identify with them. And she said, I don't really understand their plight. I don't understand their circumstances and their environment. And she asked me if I would take those 2 young ladies on as clients. And so I did, but I was a birth doula, which meant I met with them a couple times, went to the labor and delivery with them, and I quickly realized that those women needed a lot of support prior to the labor and delivery room, and by the time we got there, it was too late, to really dive in deep to what their issues had been, and I witnessed a lot. One of the families had a history of post-traumatic stress disorder. I'm talking 3 generations, the grandmother, the mother, the daughter, and all I could think about is this baby that I had helped her or supported her delivering, that would be her future as well, the 4th generation. And so very simply, because we live in the times now of technology, I put out a PSA on Facebook and asked if there were any other African-American doulas in Cleveland and if people could tag them. And lo and behold, we found some, and some of them are here. My team is here. Some of my team is here today. And so we started out as this concept around, we all have full-time jobs, and we volunteered to provide supportive services to women within our own neighborhood, which we, for the most part, ironically, we all lived in a Glenville neighborhood, and we had never come across one another ever before. And so we formed this, this group, And we started to provide those supportive services to mother way ahead of time before they went into the labor delivery room around workforce development, around education, and around maternal mental health too. You know, I think that you know, as African Americans, we have a different type of trauma. I hear the trauma-informed, you know, work. It's becoming another buzzword, but African Americans have a different type of trauma. You know, we have ancestral trauma, we have our current lifespan trauma, and then we sometimes have our own personal trauma that's associated with a lot of the racism and the things that we heard today around equity. So when we talk about equity, I think that we need to talk more about it being an African American experience in this context, because it's different than what you would normally define as trauma and trauma-informed. But from there, I had been working on a wealth building initiative with the Cleveland Foundation for some time, and then they took a approach into health. And so I was asked if I was interested in maybe creating a training or bringing a training to Cleveland for African American doulas. And so we were initially funded $125,000 from the Cleveland Foundation to do a pilot in the Huff neighborhood, to where we would intentionally recruit, train, and hire women from that neighborhood so that it would also bring some economic empowerment to that community. Now, all the doulas start off making $20 an hour, and they get paid $500 per birth. And while that isn't closing that 228-year wealth gap, we think that it at least provides some micro-level empowerment from an economic standpoint. And, you know, because I've had the opportunity, and I have certainly been blessed to have the opportunity to be able to melt the community and economic and workforce development piece with the health equity piece, our mission is pretty much around supporting women and families in a holistic lens. So, I mean, we have areas of preconception and pregnancy, postpartum, maternal mental health, housing, you know, helping people to get through what we call our perinatal pipeline. We spend about 80 weeks with the mother. We're with the mother from early pregnancy, we attend a labor and delivery, and we're there until the baby is at least a year old. And sometimes we can go even beyond that, depending on the type of support that family needs. And so from our initial grant, the Ohio Department of Medicaid followed up with the Cleveland Foundation, and they actually awarded us a $1.2 million grant to be able to, thank you, to be able to support women across Cuyahoga County. And so even our hiring, our training, everything is very intentional. Our model is very intentional because, again, understanding that African Americans suffer from a different type of trauma. This is just from a cultural standpoint, you know, and that's more on a macro level. I look at the social determinants of health, which are very necessary to address. That's more of the micro level, because those are things that we can actually put resources into doing, right? To have more housing and, you know, more jobs available, or, you know, encouraging entrepreneurship and business development within our communities. But to address the trauma as a whole, that's more of a macro level sort of thing, and it has to be important to us, you know what I mean, to address it. And some of us are just really oblivious that that is even the case, because it has become our norm. And so to speak to, I'm sorry, with Greg Brown, I'm sorry, I didn't want to touch you. But yeah, about the comfort zone, you know, I think, or being uncomfortable. You know, one of the quotes that I'll use today is to say that, you know, the comfort zone is a beautiful place, but nothing ever grows there. And so I'm uncomfortable every day, right? Every day, every setting that I go into, I'm usually the only African American person. And so I'm uncomfortable every day, you know, and so in order for us to progress and move forward, we have to do, at least in my opinion, you know, less of trying to convince others of our plight and more work on ourselves and within our culture.
So part of this, yeah. Part of the concept that we're trying to push forward is this whole notion of interrupting or disrupting, depending on how strongly you might view what your work incorporates. but we heard about how standards of care are not applied equally to people of various ethnic and racial minority groups. So I wanted to talk a bit to Margie about the REAL project at the Metro Health System, what it is, why it came into being, and what are some of the outcomes that you're looking to achieve.
So thank you, Sandy, for the question, and thank you all for being here. As we all know, historically, this country has not always documented real race, ethnicity, and language. We've had others put that on us. I'll give you an example. I sat in a meeting with some of our leaders, and one of them is a medical director, and I didn't know anything about her personal life, and we started talking about real, and she said, I totally relate. My children are biracial, and they just look at the mother, and that's the race or ethnicity that you get. And so she says, my children want to identify as their other half. We all do. We want to be seen for who we are. And so a lot of times certain people have that lens. And so what REAL does, it's a couple different things. It's based on, first of all, foundational work of the national class standards. I want to bring that up. National class standards, the pledge to health equity that Dr. Boutros signed for Metro Health. But what REAL does is it helps organizations, it creates a roadmap to help organizations accurately collect real. And we all know, especially now, and this has been historically, this is not new to healthcare organizations or systems. This has been an ongoing, and thank goodness healthcare realized that this information is critical to know the populations that we serve. It's important to promote health equity, reduce disparities, and improve quality. So those are the three basic foundations of the principal work that we're building this on. But collecting real is an educational program for staff. And it is to create that awareness of what it is and why it's so important and how it impacts people that we touch every day. I just taught a class yesterday, and you know, people are so used to going through the data so quickly and just putting something down or scheming through it. What REAL teaches you is the why. Why is this important? And those demographics identifies that person of who they are and what does that mean to their health care, and what does that mean? How are they impacted by the social determinants of health? As you all know, Metro Health serves over 50% of our patient population is from underrepresented groups. There is a lot of cultural diversity. And so to promote wellness, we have to treat the person holistically as a whole. Race, ethnicity, and language is important for the providers to see that wholeness and how it impacts. We know there's many factors that we could say. We can go on and say, well, for the the providers, we say, well, there's a genetic, some of us are predisposed, right? For the Hispanic folks, I would say to them, I always joke and say, we're all races. You know, how do you singlify that? You know, how do you self-identify? That's not easy to ask, and especially in this climate. We have people from all over the world coming to us. People get anxious. This is not very easy. If you didn't have to think about when you went to the hospital and race, ethnicity, and language was not difficult for you to answer, that's not the case for all folks. There are historical things, I don't need to get into detail. There's history behind some things that happen. Yes, sadly to say, in our medical history, that people are now fearful just to get immunizations. They're fearful just to talk to their doctor about what's going on. They're fearful, who is taking this information? Are you reporting me to immigration? Are you reporting me to the police? Who are you sharing this with? Are you going to treat me different based on my race? How is that going to impact my health care? All of those are legit questions that our patients ask when they come through the door. And guess what? We're accountable for their health care. We need to know how to address them. They have a right to know. They have a right to understand why we need this information. We need to understand the populations that we're serving. We cannot promote health initiatives and programs without knowing who our patients are. Where are the gaps? How do we increase access? How do we remove barriers? Are there language barriers? Are there culture barriers? So what Real does a lot. What it does is it helps us target populations. Where are those gaps? How do we need to make those outcomes equitable, whether it be being culturally sensitive, printing material in a different language. So it's an onboarding, and this has been a 3-year plight, at least a good solid 2 years in a organization that has about 7,500 employees and growing, 25 different sites, now 3 hospitals. And you have to it starts with the buy-in of leadership. And it is a process that was collaborative. All system departments, this was just not one team or one person. It takes a system and partnerships to move this forward.
Thank you for that. I wanted to dig into a little bit about implicit and explicit bias as it relates to Real, but before Greg has to go, I want to ask you a couple of things in short order. I want to ask you if there are any best practices or promising examples for what economic inclusion looks like, and then with the emphasis on big data, what are some of the measures that could be put in place and monitored to ensure that we are advancing an inclusive economy?
Well, I'll try to address the first one about some best practices or promising approaches, and then I'll try to talk about big data. And then I will have to excuse myself. Right at the time this is getting good. I'm sorry. In terms of best practices, I would say that Aspen Institute really did design a way of thinking about economic development that has kind of been out there for a few years, but is just now starting to take hold. And it is called inclusive economic development. And it really does talk about thinking about the idea of economic development differently than just what is the return on investment that we make either from a government, a foundation, or private sector investment, as opposed to what are the economic and social benefits to be derived from developing a strategy of economic development that is inclusive of all the people, including those people where the economic development project is going to take place. The other aspect of this is using an equity lens and asking the question, is this economic development project fair? Is it just? If it is fair, who is it fair for? Who does it discriminate against, or who does it hurt, and who does it help? And last, if it is just, what does justice look like in the context of that development? Once again, if you can see, I'm asking different questions, and those questions are not the question. I'm a guy that's been in economic development since I was about 26 years old, and community development. Those are not questions we ask. We ask about, is the property developable? What is it going to cost to remediate the property? What is it going to cost per foot to put some new development on this? How are we then going to recruit folks that will provide us with a context for getting our investment back? What is the payback period for that? And what is the return on investment over time that allows for us to reinvest in those kind of properties? Even financial institutions, governments, whoever is doing the lending, they use a very narrow framework in terms of determining what's a viable project and what is not a viable project. So in fact, you have to question that narrow framework, get them to broaden it and see that a different way of thinking can lead you to different outcomes and different benefits for different groups who inherently have been left behind. So that's one that I would talk about, and you could go to the Aspen Institute, or you can go online and read much more about it. It's one of the things that we started to use through a initiative that was created for 4 cities about 4 years ago called Forward Cities. Forward Cities just merged with CEO for Cities, which is something that is spearheaded here on campus. And the whole idea behind that is what they call inclusive economic development and economic competitiveness. And the whole idea is to look for those individuals who inherently have not been part of the economic landscape and develop their skills and capacities so that they can create small businesses and those types of activities. And Freddie can talk a little bit more about it because Freddie was also part of the local councils, as was I. And then using big data. Once again, I think the biggest problem that I've seen with the way we collect data is not that we don't collect data, but we don't understand how to use that data in terms of population improvement. We can talk about really great ways of thinking about interventions or programs or services, but the real deal is how do we move populations that have inherently been left behind, and how do we measure those things that are important for us to know? Well, first of all, you measure what's important. So we haven't been measuring the things that are important to those people who are left behind. So we need to start to identify what those measures look like. How do we capture that data? What do we do with that data once it's captured? And then how do we hold people accountable for what is represented in the data? We don't hold anybody accountable for anything anymore. You know, in fact, leadership is all about, I didn't do it, okay? It wasn't my fault. He worked for me and he did it. So get him, even though he worked for me and I employed him and I told him what to do. So the issue with big data is, I think, once again, we have more data than we've ever had, but I don't think we ask the right questions on how to utilize the data as a tool, number one, and number two, how do we hold people accountable in terms of being more inclusive, more collaborative, more expansive in their worldview, more multicultural in their orientation, and last but not least, more fair and equitable in the way that they dispense resources.
Thank you. I know you have to leave, and we want to thank you for the time that you were able to spend with us. And while you're exiting the stage, I want to ask Freddie, who is the director of the city's planning commission, to talk a little bit about the mayor's neighborhood transformation initiative and how that aligns with this whole notion of disrupting usual practice. Mm-mm.
So good morning, everyone, or afternoon. So I want to talk a little bit about the Mayor's Neighborhood Transformation Initiative. This initiative really was something that the mayor and the administration really wanted to focus on in order to transact equity. You know, we talk about equity as a framework, but equity is really embedded in how we actually do business and how we move. So the administration really wanted to focus its attention in on inherently disadvantaged neighborhoods in the city of Cleveland. And the initiation of this really was started through a study that was done through the Center for Population Dynamics, where we really started to look at development patterns and housing patterns in the city of Cleveland, as well as where jobs were happening in the city. And one of the things that was recognized is that most of the job growth was happening on the city's east side, which is largely a minority population. And most of the housing and real estate development was happening on the west side of Cleveland. So you had this sort of spatial mismatch where you had all of these employees coming in and out of University Circle to jobs, but we were living on the west side in exurbs, while neighborhoods around where these institutions were suffering. So part of the work that we were tasked to do from a planning and strategy perspective is really to look at how do we begin to invest in neighborhoods that flank where significant investment is happening. And it was a situation where you had the haves literally right next door to the have-nots. And when you saw that dynamic take shape, and it's not just a Cleveland thing, this is happening around the country, where you see neighborhoods that are close to large-scale institutions and things like that growing, and just down the street or a block away, you see tremendous blight. So in the city of Cleveland, we have somewhat of a unique advantage. We have a unique advantage because land values in the city of Cleveland for the most part, in many of these neighborhoods, are cheap. Now, that could mean one or two things. It could lead to gross gentrification, or it can lead to creating equitable opportunity. So the administration's approach was to draw down $100 million in bonds and take a quarter of those bonds, or $25 million, working with financial institutions, philanthropy, and others, to come up with about a $70 million fund. The $70 million fund had to be strategically invested in specific neighborhoods. And we had to get this passed through council. And part of our narrative was really focusing on the issue of equity and what that meant. And we had to literally pose that question to 17 council members who, for the most part, traditionally has seen their area of the city as their priority. So you can imagine how difficult that prospect was. We, however, was successful in getting legislation passed in order to receive and spend these resources. So what are we doing with it? The Transformation Initiative really focuses on wealth building as a premise. And what do I mean when I say wealth building? Many of you heard statistics about redlining. You understand about the suburbanization of America and how the Homeowners Loan Corporation was able to provide loans to GIs returning from the war in 1945, and how those loans were afforded to white GIs and not black GIs, which created isolation in urban areas, but promoted the suburbanization and new housing construction in the suburbs. The legacy of that has led to some of the issues that we are dealing with now. So part of our strategy is really to build wealth. And if you're not born into wealth, you can only achieve it in one of two ways: through real estate or business development. And let me give you a tangible example. One of the West Side developers that we've been working with came to me and he says, Freddie, we're seeing $50,000 to $80,000 dollar down payments on infill housing that they're doing on the west side of Cleveland. $50,000 to $80,000. So what really does that mean? So you have people who don't look like most of us, who have the means to put that type of a down payment down, which signals an equity stake in neighborhoods because they're resourced and they can do that. So part of what we're trying to accomplish with the Mayor's Initiative is to create a situation where through the banking products that we use and through the type of real estate development that we do in these neighborhoods, that is done in a way where individuals who otherwise couldn't obtain properties could obtain properties, but also get into loan products that can give them a true opportunity to pay a property off in their lifetime. The other component to that is really this notion of entrepreneurship. Part of the work that we're doing around entrepreneurship is really trying to create an opportunity for business startups in neighborhoods where these new markets are emerging. So we made an announcement a few weeks ago of a $15 or so million project on 105th Street in the Glenville neighborhood, which many would say, man, that's a risky proposition. But when you look right next door, where you see the investment on Wade Park, you see the investment that's a stone's throw away in University Circle, and you see the administration stepping in to help establish or reestablish value in the neighborhood, this becomes less of a risky proposition. And here's what we're starting to see from that. So in the next year, there's going to be a 63-unit development with about 13,500 feet of retail. The city is going to be master leasing the ground floor. So we're going to be leasing out the ground floor to business startups and minority businesses. What it'll be designed to do is to ensure that the rents are written down so that businesses can incubate and grow out of that space. We're also going to be partnering with Case Western Reserve to do co-working space. Now, this is all designed to help stimulate entrepreneurship and minority entrepreneurship in our communities as they evolve. Now, when we talk about neighborhoods like Glenville, like the near West Side, Clark Metro, around Metro Hospital, we're really trying to leverage investments that anchor institutions and other organizations are making in order for those neighborhoods that exist right next door to them to feel the impact. One of the things when we talk about University Circle, or we talk about a metro hospital where you have thousands of people who come into a place and leave every day without touching a neighborhood or without spending a dime in a neighborhood, you have to begin to change the conditions in that neighborhood so that we can capture that market. So who needs to be the recipients of that market? We believe it could be minority entrepreneurs. But they need the space, they need the place, they need the support, and they need the wraparound services in order to leverage that. And then lastly, just touching on this initiative, it's really rooted in making sure that we invest in neighborhoods that are on the fringes, or neighborhoods that are on the margins. Many of you who are familiar with Cleveland and familiar with development patterns that has happened in this city, there's always been this dichotomy between University Circle, downtown, and the neighborhoods. And when people see the near west side growing, or downtown growing, or University Circle growing, it's like, okay, what's going on right next door in Glenville? What's going on in Fairfax? So this is the next wave of investment. The challenge is going to be, how do we ensure that that investment is equitable? And without the intervention of the administration, without the intervention of like-minded partners, and I stress the term like-minded because the administration is not interested in working with everybody. Part of the vetting of partnership is really trying to identify the partners who share the same value proposition that we do. Because we're putting a lot on the table and putting a lot on the line financially to create the opportunities to change these neighborhoods in ways that the free market won't. So we're already starting to see now, which is a dangerous proposition, private interests starting to come into Glenville, wanting land bank parcels, wanting to buy up parcels and put in new housing product. And these product price points are going in excess of $250,000 in Glenville, close to 118th Street, right near University Circle. Do we want that? And the reason why I'm bringing this up, because it begs the question about the G word, the gentrification word. And I got asked by a student a couple of weeks ago, you know, can we create neighborhoods where, you know, gentrification, you know, doesn't happen, or can we manage gentrification? That was a tough question, because at the end of the day, you need to have people coming in, but from our perspective, you have to also be bringing people up. And when we think about the ability of the city to create policies that allows people to move up and down the economic ladder and create these sort of mixed income neighborhoods, that is ultimately the objective. And we're doing that by creating multiple price points, multiple products, multiple types of units, and creating that diversity that can actually foster that idea of what a mixed income neighborhood is. And the last thing I just want to say, when you talk to people about the affordable housing dynamic, you talk about affordable housing, most folks think, who are privileged, that that's housing for those people. And my response when I talk to most people about this is that you got to understand that most of you around the table are a health condition or maybe a couple of paychecks away from being those people. So the conversation has to change to making sure that we're creating neighborhoods that can catch people when they fall, but also allow people to come up.
I appreciate that. I'd really like to get into some more conversation about land use, but we are like so pressed and behind time. I want to at least be able to pose a few questions first to Dr. Cobb and then to Lena. And we've heard a bit about like what's going on in neighborhoods. And I know that you had a theme that you expressed to me about, I may say this wrong, but it's the health. Yeah. So can you talk to us a bit about, you know, that whole concept of ministering to the whole person and what that looks like in the context of neighborhood?
Yes, thank you so much. One of the things that I've noticed as I've been pastor of Emmanuel Baptist Church is that we have closed our minds to what is happening outside of the stained glass windows. And because of that, we are missing some important opportunities, and not only important opportunities, but we are not seeing and not understanding what I believe our Bible really says, because I believe when we look at health, we need to see that the same way we see Bible study, the way we see Sunday school. That would be my hope, that we would begin to move in a direction where we understand that it is just as important. Many of the people who attend churches similar to mine, they don't live in the community. And so therefore, they come in and then they leave out without understanding that what affects that community, not only, it doesn't just affect the people who are in that community, but it affects all of us. And so we've come up with this theme, Healthy Church, Ministering to the Whole Person, Are You All In? And the mindset there is that we're talking about spiritual health, emotional health, physical health, mental health, financial health, because, and it centers around education, and not only education, but the idea that we've got to be participants in this. We've got to start being part of the solution and not just seeing it as those people. And so we have work to do that and begin to mobilize and understand that there must be collaborations that have to be done. We can't just be us alone, but we have to then get like-minded people who partner in what we're trying to do, because it's not just because when we have a healthy church, I believe then we can move forward to having a healthy community and a healthy city, and really going in without going too long, but understanding when I say education, I'm not just talking about a working knowledge, but I'm talking about understanding, as we've been talking about today, the systems behind the problem. That many of the people that we are seeing, those who we are serving, that there's a system that is going on that is causing what we began to see is not just simply that a person wants to be that way, but that there are systems that are in place that have created the actual circumstance that we have. And then I believe once we understand that and people understand that, then we can begin to see health as a moral issue, a moral issue. And I'll be one to say that I did not see health as a moral issue until I was diagnosed with glomerulonephritis. And when that happened to me, that is an attack on the filters of the kidney. And so therefore, I had kidney disease, and I had to go through this process. And I praise God today that I am now 8 years of having a working kidney, and that has allowed me to be able to do the work that I'm doing. But in that process, I began to see how some of the systems were in place that basically kept people down. As it relates to dialysis, many of us don't understand that there are ways now that you are able to have a better quality of life, but because of the way we desire to do it in the name of money and dollars and cents, there are people who are actually dying on the machines because they don't do that. And then when we go and once you get, for me, a kidney, you move even further and you find out that there are certain medicines that the insurance companies will not allow you to get, and you have to go out of your pocket to pay for it. And because you have to, many of the people who need these services don't have the dollars. Now, all of a sudden, they are put in a position where they are forced to either not use the medicine as it's really prescribed, or you have to take, even though you need that pill every day, you have to take it once a week or 2 or 3 times a week because you got to save money, because basically the insurance companies who we're still paying premiums to say to us, well, even though you're paying these premiums, you know, you can still afford $100, $200 a month. And I don't know about you, but I'm not a person that, I praise God for my church and what they're giving me, but I don't have $200 a month to take care of that. And if you don't have the right advocates, if you don't know the right people, then you have a situation where, unfortunately, people are brought down. So that is what I've been trying to emphasize at my church, and understand that it's not just simply this person wants to be that way, but it's a moral issue for all of us. It's a spiritual issue for all of us. And just as we raise the banner on Sunday school, and we raise the banner on Bible study and worship, we have to raise the banner on health.
Yeah, thank you. What you've alluded to is this notion that the choices that we make are based on the choices that we have. And we talk about that all the time in the National Place Matters movement. I want to ask Lena, and then I'm going to ask Dr. Colvin one last question. For Lena, if you could just talk to us a little bit about the NeoMed CSU partnership and the pipeline that's been created.
Okay. Yes, I'm happy to do that, Sandy. Thank you. So I am with the NeoMed CSU Partnership for Urban Health. It is a newly formed pipeline through medical school. I was just talking with someone, and I learned, my co-director, Dr. Sonia Harris-Haywood, and she shared with me that we currently have 7 to 8 students who have graduated and are in current residencies, and so I'm happy to share that. We will also have 15 students to graduate this summer from our medical program. I am so very happy about that. The program was actually created to eliminate health disparities. So as you probably already know, that there is a primary care healthcare workforce shortage in general, but specifically for people of color, providers of color. So our program addresses creating primary care physicians in urban communities to address health disparities. So not only are we supporting students who may be non-traditional students, particularly students of color, students who may come from those same underserved communities, but also understand some of the tenets as it relates to the urban community. So it's a 6-year pathway through medical school. They do 2 years on the CSU side, 4 years on the medical school side, and I am so very happy to say that I lead the urban health curriculum. In my curriculum, I make sure that every student does not leave my watch without understanding the core tenets of health disparities. And one of the things that I share with them on the very first day of class is that either you are intentionally dismantling health disparities or you are part of the problem. There is no in between. And so students learn early on that healthcare is not only people's health, that it understands that you are looking at the whole person, valuing the whole person, that everybody has a story. So one of the things that we do that I think is very innovative and creative, and I really have to give a shout out to Dr. Jackson, who is the leader for the CSU arm of this, we do an intentional, inclusive, holistic interviewing process. So when students knock at our door to say, I'm really interested and I have this dream of becoming a physician, but I'm not quite sure what to do, we help that student along the pathway. So the traditional method of becoming a physician, that you typically look at a person's numbers, their GPAs, their test scores. So we go beyond that. We do look at those things, but we also value what Dr. Jackson commonly calls the grit, the resiliency. Many of our students are post-bac students, which means they have their undergrad 4-year degree, and they have been in the world for some time. They have experience to share and lend. And through that discovery, they understand that their calling has been to become a physician. And so they come to this program with passion, with dedication, with commitment, with the openness of knowing that I do not know everything, I am here to learn. And with that, we help to create the future generation of physicians. And so, Kristen, you talked about being able to go into communities and connect. And Freddie, you talked about having economic development within communities and tying all these things together. And so one of the things that we would like to see in the very future is that as our students go through their residencies and we have more students to graduate through our program, that when you walk through your doctor's offices, that they will be more culturally competent, they will be able to communicate while they assess your health, that they value the whole patient, that they understand that there may be medications that you need in order to be compliant, and they understand what those resources are to help you do that. And so part of the partnership's mission is to make sure that we grow and develop the next generation of healthcare providers as it relates to primary care, but also we meet the needs of our communities. So one of the pieces that is very near and dear to my heart is the experiential learning that happens for our program under the urban health curriculum. So not only do we have lectures and we give our students information that they might not ever receive through their medical school training, we get our students out of the classroom into the community. And I'm not talking about the fishbowl experience, let's take a bus and go through here. No, we start building relationships early on. So when you are a thriving and contributing physician in our urban communities, you know who is a great collaborator. You know some of the nuances about certain communities. You know when we need an advocate who you need to reach out to. And so we understand how very important this is if we need to eliminate and destroy health disparities.
So one final question, I'm going to direct that to Dr. Colvin. I don't know if we have time at all for the question and answers, but I wanted to ask you, as the co-founder of the Greater Cleveland Congregations, the largest multiracial interfaith social justice coalition in Northeast Ohio, what you can tell us about why it was founded and what you've learned from its efforts to date as it relates to social determinants of health and community-led visioning and practice.
Greater Cleveland Congregations, as you pointed out, is 40-plus congregations that of different faith traditions that operate out of shared values to do the work of justice. For us, probably best stated, I think, in the words of Cornel West, who said that justice is what love looks like in public. And so we live out the value, the universal value of love through our traditions, through doing the work of justice in the public sector. We do that by what we call, through the methodology of building power. You have to build power. And what is power? Power is the ability to make someone say yes when they want to say no. And if you can't do that, you have no power. Power is the ability to make someone say yes when they want to say no. You can have influence, you can advocate, be an advocate, but you have no power if you cannot make them say no. And so much of what has happened and transpired in our history, while we integrated into our American tapestry narrative of the great melting pot, most of what has happened in our culture and our history in the form of what is progressive toward equality and equity is because people got enough power to make people who wanted to say no say yes. That's how it works. And we recognize that there are various sectors. There is a public sector, the government, which has a great deal of money. There is the private sector, which has a great deal of money, and we call those sectors organized money sectors. So we cannot compete with them in the area of money. We organize money, but not at the level they do. We organize people, because people is this world's greatest natural resource. And so we organize people to build power, to exact change in a fashion and a way that is much more in line with the vision that they believe is for their communities. And we draw on not only shared values, but shared indignation. One of the things we do in GCC, when we sit down, we have one-on-ones, we sit down and have one-on-ones, we have house meetings, and one of the questions that we ask is, what makes you angry? And anger is a wonderful motivation for change. Because you'll ask someone in the neighborhood, what makes you angry? I'm angry about the fact how long it takes an officer to get to my neighborhood when something happens. Are you angry enough to do something about it? And you get a response. Then you ask them, are you angry enough to find 5 other people that are willing to do something about it? Are you angry enough to do something that you would have never done before, like speak up and speak out? Are you angry enough? And oftentimes, some of the challenges that are happening in our neighborhood and community is that we're not mad enough. We're not angry enough to make change and drive. And so we draw on our shared values and our shared vision for community, but also on our shared indignation. And we do not leave it simply to those in the public sector and the private sector to do things that determine our lives. Why would I do that? When Tamir Rice was killed, I have 2 black sons. I'm not going to leave it to the mayor. I'm not going to leave it to the city council. I'm not going to leave it to the chief of police, because I have 2 black sons and I need to make sure that I use every advantage I have to help them change, to make sure it does not happen to them. And if I relinquish that responsibility to the elected officials or the private sector or the foundation community, I am not being a good pastor, and I'm certainly not being a good father. So we draw on those things, and we fulfill our responsibility as people who participate in democracy, because one of the great mistakes that has been made, that we don't understand, that voting comes at the end of a democracy. It is the last thing you do in a democracy. Speaking up, organizing, getting signatures, going to meetings, sitting down with your public officials is what you do before you're supposed to vote. We have been led to believe that voting is democracy. Voting is the last thing you do in a democracy, a cycle of democracy. So we organize, and what we realize is that we have seen is that when you, and I'll close round third on this, is that when you organize people, amazing things happen. For example, in our Metro IF, because that's our umbrella organization, in Boston, the Greater Boston Interfaith Organization was the organizing group that moved for universal health care in Massachusetts when they had a Republican governor by the name of Mitt Romney who did not want to do it. But they had enough people organized around Massachusetts, this one little organization of faith groups, to make a governor who wanted to say no. They made him say yes. When in Southwest Washington, D.C., when the Washington Interfaith Network found out that a billionaire who had bought the Montreal Expos that became the Washington Nationals had a stadium that was being built for him in Southwest Washington, D.C., a place of urban blight, they organized and made sure that when they put that $400 million for that stadium, they established a $50 million neighborhood capitalization fund that is now at $100 million. No, they didn't have plan on doing it, but when enough people raised enough HE double hockey sticks, they were able to get it done. We found out when we organized in the work in East Brooklyn congregations that it doesn't take as much bureaucracy as you think. East Brooklyn congregations has a $300,000 budget, has never been over that, but in that time of $300,000 budget, they built over 4,000 homes in East Brooklyn, which is the worst part of Brooklyn that you could ever be in. Because these people who live in these neighborhoods said that we are not simply going to leave it to the public sector or the private sector to define and determine our lives. In Baltimore, people organized and they got the first living wage bill. Baltimore's United in Leadership Development established the first living wage in America. These were our sister organizations. Here in Cleveland, what we've been able to do by organizing people is that, one, we've been able In the work of gun violence. We were able to work with the county to establish the needed gun lab that they needed. We were able to move toward reducing the persons receiving formerly receiving felonies for which should have been misdemeanors under McGinty. We pressed them, we pushed them, and we got that reduction of 25%. We pushed based on a model that we found in Brooklyn with the new prosecutor, O'Malley, and because of our recommendation, we pushed for the establishment of a civil rights division, the first of any kind in the county. Never had a civil rights division in the county. But you might have heard recently that there was a gentleman who had been in jail for 15 years for a crime he did not commit. Mr. McGinney twice did not want to look at his case. But it was given to Mr. O'Malley under his civil rights division, and the person that oversaw that case was the person who was assigned to the Civil Rights Division. If we didn't establish that Civil Rights Division, this person may not have been hired, might not have had passion to look at this man's case. This man might still be in jail. So you got to be willing to do the work. When it comes to gun violence, not only did we do the work here in the county, we have sat and met with Atlantic Gun and Tackle, which is the largest distributor of guns in Northeast Ohio. We have sat and met with him, but not only did we sit and meet with him and talk about what he needs to do in his security, we sent people to the annual meeting in Germany to talk to the folk at Glock directly about what they needed to do. And the truth of the matter is, if you only wait for those in the public sector and the private sector to do their jobs, you are not doing your job. And that does not mean that they have to become adversaries. This democracy hinges on a three-legged stool of the public, the private, and the civic sector working together. And if we are not doing our responsibility as citizens to organize people in a civic manner to lead towards social change, we are failing ourselves and failing our children. In the words of John Lewis, sometimes you have to cause necessary trouble. And oftentimes, many of the people that we make saints now, at a period in which they were doing the work that they did, they were vilified. Nelson Mandela was not considered a non-terrorist by the U.S. Justice Department and the U.S. and the FBI until 2009. Dr. King, at his height, had a 40% approval rating among African-American people. And so oftentimes, we have to recognize that we have to live out our values, and oftentimes, not only does it make society uncomfortable, but it also makes us uncomfortable. But in the words of Maya Angelou, courage is the most important of virtues, because if you cannot live out courage, you cannot make any of the other virtues even possible in your own life. So, thank you.
Thank you. We want to thank the panel, both for their time and their expertise and their energy. And as you can tell, there was a lot more that we could have delved into. Do we have time we don't have time for questions from the audience, do we? Do we? Okay. All right. You want to read them? However you want to do it. Okay. Okay, the first question. You talked about involving community on these committees, but where is your community representative on this panel? Their input is the root. So I'm going to let Christian handle that.
I am the community.
That's right.
I am African American, obviously. 93% African to be exact. But I think that people in the community are very capable of uplifting our own communities, right? I think to a lot of the points that were made here on the panel today, we wait for other people to save us, when we are our own saviors. But I do believe that people do have to look to some sort of leadership to help lead that, and I also understand that too. So as a leader, there is a great responsibility, to be able to lead, your community along the path, and to say, and to speak up and to say that, no, I won't stand for this. Integrity is everything. People come to us all the time and they want to donate money, and I think that that's great. But if that money comes along with some strings attached, or to change our model, then we don't want it, right? And so within our organization specifically, all 20 of us, so I have a staff of 20 women, and our women all live in the communities that have the highest infant mortality rates. And again, that's intentional. So the community is there and the community is willing, but, you know, to Dr. Yearby's point earlier, pay the community, you know, because those are the experts. You're coming to the community to find out what's going on, how can we help, what can we do. The experts are there, they live there in the community. So a big part of that, again, I think is leadership. And allowing people in the community to stand up for themselves, or just the community allowing themselves to stand up. You know, again, I am of the communities in which I speak. You know, I live in the Glenville area. I grew up in the Huff neighborhood. I graduated from Collinwood High School. I went to Kent State University. I lived there for 8 years, and I worked at a nonprofit, and I said, if I'm gonna help a community, it's gonna be my own, and I moved back home. And so my passion is centered around true equity, you know. So yes, I do work specifically on infant mortality, but infant mortality is just a symptom of a much larger problem, right? It's not just infant mortality. We know that African Americans have the worst rates in everything, right? And then the things that can be helpful to us, you know, we also have the worst rates in those too. So I think that, again, there's a lot of people that I work with that are of the community and for the community, but sometimes the visibility isn't there.
And so we'd like you to carry that question into your planning processes when you get into your groups. You get that similar answer from Freddie Collier, from both of the pastors, from Margarita, and also from myself in terms of what hats we wear. And you may hear the institutional hat, but there's also a story behind that institutional hat that would tell you how these folks are of and are the community. But carry that thought, because that whole notion of community-led visioning and planning is central to the health equity framework that we're espousing. We have a question specifically for Lena. How many African American and Latino kids has NeoMed graduated? Oh, is she still here? Yeah, okay.
Yes, I'm still here.
All right.
Well, I did not bring any statistics with me today. Is it okay if I give that question to you, Sonia?
We have not graduated one yet. We are just finishing up our pilot phase of the program. Next year, we are scheduled to graduate 5, I believe, and all of them right now are pursuing primary care. Maybe a better number is what percentage of African Americans we have right now across the 6 years, and we are about 25, I believe 27%, with about 80% of those 27 actually having a strong tie to Northeast Ohio, and about 75% of them grew up and were raised here in Cleveland. So that is probably the most exciting thing. And those who are coming out next year will also be pursuing residencies in Cleveland at Metro, Cleveland Clinic, and UH. So we're starting now to see them coming back. We do have a goal of 30%. That's what we are shooting for the next year, and we're hopefully looking to expand that. We're going to train the students here. We're going to recruit them here, and our goal is to get them back here.
Okay, thank you. So when I walked in the room, I heard the speaker saying that we need to be comfortable with being uncomfortable. And I appreciate the fact that you guys are being open and honest about what your concerns are. So we have one final question, and it's for you, Freddie. It sounds like we are developing city policy to bring white people money to black neighborhoods. We are taking, I think it's saying we're taking for granted that these white people need to be comfortable in these anchor institution adjacent neighborhoods. What is the city doing to change white people's values to appreciate the existing cultural attributes of that community?
That's a pretty raw question, so I'm gonna be pretty raw with my response, I guess. So the notion of white people money into black neighborhoods, well, if you're minority business owner, I don't care what your money looks like. What race is behind the money? When you have neighborhoods in the community and you have people who are coming into the community, I think it's beneficial to capture those resources of individuals that come into your community. And I think it opens up a new market for those businesses that are trying to stabilize. I think the real question that is at the core of that is really what are we doing to ensure that these neighborhoods and these communities really don't change color, and that as the economic betterment of those communities happen, that it happens for everyone. And a couple of things I want to say to that. One, it's not just one entity or one person's responsibility. From the city perspective, our policies are inclusive of making sure that the housing development that happens in neighborhoods, we have programs for existing residents who actually live in homes, who need home assistance and home restoration. We have policies in place right now for new infill housing that's going to allow for people to get mortgages for as little as $50,000. That creates a pathway for ownership. The other thing that we're doing with respect to just the home ownership piece is really trying to make sure that we create a multitude of product. So rental product, both mid, high, and low income products in the neighborhood. And we're creating the conditions for that diversity to occur. When we look at, for example, our capital investments in neighborhoods, the infrastructure, many of these neighborhoods have poor infrastructure. Working right now with a number of different organizations to make sure that these neighborhoods have the technology infrastructure in them to ensure that people have access to the internet and other types of services. So there's a plethora of things or a whole suite of things that has to happen and that we're working on doing. But that larger question with the fact that white money is coming into neighborhoods, I think that if you have dollars coming into neighborhoods and those dollars are leveraged by people of the community and businesses of the community, I don't see an issue with a white dollar being spent in a neighborhood of color. I don't.
Thank you. We want to thank the panelists again and turn this over to Lena and to Francis. And
Yes. Okay, thank you. And I once again thank all the panelists. I would like to acknowledge some people in the room. As Rakaya talked about earlier, that there are mentors, there are sponsors, there are supporters. So I really would like to thank Dr. Fred Hampton, who I think had to step out, who is an associate professor in the College of Education. And I would also like to acknowledge Beverly Charles from the Congresswoman's Marsha Fudge's office. Thank you for being here. And now I am standing between you and lunch. So we are going to dismiss for lunch. I'm going to ask that you get your lunch and return back to your seats. We would like to do a working lunch, and then we'll have someone to lead you through our real talk table session. Thank you.